Hello, my name is Suzette Garcia, clinician with Vibrant Laboratories. I am board certified in holistic nutrition, and my career setting has been centered with a strong focus in food sensitivities, including food additive sensitivities. So today, I will be discussing with you Vibrant's food additives test. Vibrant Additives offers very specific antibody to antigen recognition to an array of 57 commonly consumed food additives. This panel measures an individual's IgG and IgA sensitivity, which can aid in differentiation of food additive sensitivity from food sensitivities. Being able to test IgA antibodies alongside IgG antibodies provides additional information on food additives that may be causing mucosal damage. This antibody-based test can help prioritize the necessary foods to eliminate, avoid, or rotate, and create a customized diet plan around the patient's specific needs. The lab results also include definitions and sources of exposure, so that way when there are sensitivities detected, we can know how to avoid these particular items. A primary piece to understanding antibodies is in their area of origin. Origin can be IgA, which would be produced by saliva, tears, and mucus linings in the lungs and in the intestines. We can have IgG antibodies, which are the most abundant in serum and are produced by almost every cell in the body. IgG antibodies can cross the placenta. These antibodies also have considerably different half-lives. IgA antibodies have short half-lives. Elevated IgA antibodies indicate exposure within 2 weeks prior to testing, while the half-life of IgG is much longer and can indicate prolonged exposure up to approximately 6 months prior to testing. On this page, you'll also see IgE indicated, which that is specific to an allergy. It is not a sensitivity. IgG and IgA are the antibodies that we look at for sensitivities. IgA antibodies are produced by the intestinal mucosa as a defense mechanism. If IgA antibodies are elevated to a particular antigen, this can indicate an immune response to mucosal irritation or damage. Elevated IgG antibodies means that there is exposure of these antigens to the bloodstream and the body is producing antibodies. In terms of food additive sensitivities and intestinal autoimmune disease, IgG antibodies can occur as a consequence of and can be downstream to intestinal permeability. These are likely correlated with more systemic immune responses such as brain fog, fatigue, skin manifestations, migraines, and so on. The ideal time course for elimination is not established. Consider magnitude of antibody response, half-life of antibodies, patient's current dietary intake, level of motivation, status of mucosal integrity, and remission and/or progression of symptoms. Complementary consultations are available to consult with Vibrant's clinical team and develop personalized protocols for the patient. Food additive sensitivity should only be interpreted in conjunction with a patient's symptoms. Testing for food additive sensitivities can provide the most complete picture of total problematic foods and ingredients when run alongside food sensitivity panels. For further information on this and other tests offered by the laboratory, please visit www.vibrant-wellness.com.